Rushanara Ali.
Thank you, Madam Deputy Speaker. The coronavirus pandemic has left millions of people up and down the country with uncertain futures, struggling to make ends meet. This health crisis has robbed us of people we love, has destroyed livelihoods and shaken the foundations of our communities to its core. More than ever, the pandemic has laid bare the deep inequalities in our society, and it has shown the huge gaps in our healthcare and social welfare system after a decade of conservative austerity. We need to protect our public services, support our communities and our economy through this crisis. Madam Deputy Speaker, the government has completely mishandled this crisis. The UK now ranks as the worst hit nation in Europe for fatalities, with the death toll passing 60,000. Over the summer, after the initial wave, the government had time to get its act together, to get a grip on testing and tracing, to get a grip on the virus, but instead we've seen incompetence and failure at every turn. Their incompetence, Madam Speaker, does not know bounds. We've had PPE shortages for our NHS and social care workers, delays in testing and thereby putting more lives at risk, chaos for pupils and students through the exams, and universities' fiasco in September and October. And to top it all off, the government's own Eat Out to Help Out scheme is likely to have spurred a spike in COVID cases, according to the Prime Minister himself. The government's dithering and delay in this second lockdown has wasted valuable time. They were too late to bring down the first lockdown, which cost lives and livelihoods. And once again, this delay has cost lives and livelihoods. They failed to listen to the opposition for a circuit breaker, which meant this lockdown is now going to be even longer, with even more detrimental effects on people's lives, more deaths and worse economic outcomes, and more damage to our economy. And the warnings were there. The information was there from the scientific advisors. Ministers kept saying, and the Prime Minister kept saying, we are guided by the science. Far from it. And the evidence is very clear now.
Does my honourable friend give way?
I give way to my honourable friend.
She's being very generous and making such important points. Does she agree with me that that immediacy, that urgency that's been lacking in this country was evidenced in countries such as Australia and New Zealand, where they got on top of it really quickly, acted hard and fast, and that's why, in the case of Australia, had 0 cases over the weekend?
I couldn't agree more with my honourable friend, and there are many other countries where our government could have learnt from them and got a grip on contact tracing, on testing, but instead what we've seen is chaos. We've seen false promises made, over-promising and under-delivering, and thereby damaging public confidence. The public confidence that we all worked across party at the beginning of this crisis, in the first wave, to build, that has been squandered by the failures of this government. Madam Deputy Speaker, there are now 4 times as many people catching COVID than anticipated. The delay in introducing restrictions has already cost lives in constituencies like mine, and we're already seeing a high prevalence of death rates among those from black and minority ethnic communities, those from poorer backgrounds, very similar patterns to before. This time the government knows where the problems are, and their failure is completely unacceptable and inexcusable. And of course, we are expecting to see, through the scientific advisors' own projections in the graphs they showed to the country last week, even greater human cost, even more lives will be lost because of the delay, because of the failures to act. And that is why, Madam Deputy Speaker, it is an absolute scandal that this government has spent £12 billion on a private contractor, Serco, and they call it the NHS app. They didn't use the public sector. They should have formed a proper alliance between the public and private sector. Nobody's saying it should be one or the other. We should be pragmatic, but we should get value for money. And it seems that people who are organisations and companies that have shown complete incompetence are being rewarded with contracts. And it seems like there's a jobs programme for Conservative Party donors for contracts, whether it's PPE contracts, which I raised with the Prime Minister, and he's still failed to answer, and it's been weeks now, £1 billion of contract without proper due diligence. The rate of death among certain communities was very high. and it is continuing to be in this crisis. The government needs to act now also to provide support to the 3 million who were excluded in the first crisis, and continue to get very little support as we head towards a lockdown. They are being left out. And when children go hungry in our constituencies and public money is being wasted on contracts where contractors are failing to deliver, on some contracts, the government needs to act to ensure that we get value for money, for taxpayers' money. Finally, Madam Deputy Speaker, local authorities and local public services need desperately supporting in order to provide support to get the contact tracing done in order to get a grip on this virus. And I call on the government to work with them and support them, provide them the funding that they need in order to protect us all. Thank you.